Alright, so we continue. So to prevent and control bias, that can be done in 3 levels. Alright. Number 1, ensure study design is appropriate. Number 2, carefully monitor procedure of data collections. And number 3, appropriate analytical procedures. After you have collected data, you must make sure that the analysis is correct. So there are many types of biases. One of the most important papers, or perhaps one of the important papers for bias, was written by Sackett. You can Google bias and Sackett, you'll definitely find the paper. Right? So most of biases can be classified into 2 basic categories. Okay, selection and information. Okay, selection bias and information bias. Alright. Selection bias is present when individuals have different probabilities of being included in the study sample. So not everyone has equal probability of being included in the study sample. Some people have higher probabilities and some people have lower probabilities. So that is an example of selection bias. So this might be due to different definitions of exposure and different definitions of outcome of interest, right? Or bias in the exposure and bias in the outcome of interest. Information bias results from systematic tendency, right? Systematic tendency for individuals selected for inclusion to be erroneously placed in different exposure or outcome categories. It means that they are wrongly categorized, okay, because of the problem with the measurement, right? For example, is misclassification as due to recall bias, right? So okay, this one not that important. So the effect of bias, because inferences, okay, generalizations of results depend on evaluating the validity of the available study, which means the degree to which the study meets the basic logical criteria for absence of bias. There will always be bias, only a lot of bias or just minimum bias. When aspects of validity cannot be guaranteed by successful design strategies, right? For example, by using blinded random assignment, okay, we must evaluate the magnitude of bias arising from plausible violations of validity conditions. Again, the classifications or types of bias. Number 1 is selection bias. You select wrong people information bias, you measure wrongly and confounding. It's a special type of bias. This one in the next lecture, okay, later. So bias can be classified by the directions of the change they produce in parameter, okay, towards the null bias or negative bias. Away from the null bias produces opposite higher estimates than the true ones. Okay, selection bias occurs when systematic error in the recruitment or retention of study subjects, okay, wrong selections of people, systematically and wrongly classify participant, patients, subjects, cases, controls, okay, exposed, non-exposed, okay. Some controls are basically cases, some cases are basically controls. That's not correct, that is bias, okay. So will result in distortion of the measurement, right? And the error, also the error introduced in the study population, okay, will not represent the target population, right? So it will not represent the exposed, it will not present the unexposed, it does not present the cases, it does not present the control populations. So how to control selection bias? Can be controlled when the variables influencing selections are measured on all study subjects, and either there are antecedents of both exposure and outcome, the joint distributions of this variable is known in the whole target population, and the selections probabilities for each level of these variables are known. A bit complicated, but not that important. So, but try to remember this one, right? Example, right? Example of selection bias. Number one is inappropriate definitions of eligible population. Okay, it is produced when the kind of patients gathered, okay, does not represent the cases originated in the population. So this can be due to competing risk, healthcare access bias, land bias sampling, Neyman bias, spectrum bias, survivor treatment selection bias, Bergson bias, exclusion bias, friend control bias, inclusion bias, matching, what else? Relative control bias. This one is what? Friend control, using your friend, using your relative. Number two is lack of accuracy of sampling frame. For example, in